The following segment is sponsored by Northern Nevada Health System.
We're here at the Northern Nevada Health System with Angela Smith, a registered nurse who deals with chest pain. In fact, you're the head coordinator for chest pain issues here at the hospital. Is that right?
Correct.
So, chest pain. When do we know we have a case of chest pain that we need to maybe come to the hospital?
Yeah, it's a really, really good question and a very, very important one. If your chest pain is associated with any nausea, vomiting, sweating, changes in level of consciousness, so lightheadedness, dizziness, or even fainting, that's a really good time to seek some medical attention. Also, if that pain radiates, so if it goes to the neck or the jaw, one or both shoulders and the back, those are signs of something that's pretty important that needs to be checked out.
So that's chest pain. What's the difference between chest pain and chest tightening?
Yeah, so a lot of times patients come in and they say, I have chest pain. And so as clinicians, we are trained to ask some follow-up questions. And one of those is, please describe it. And so a lot of times the patients will describe their chest pain as a tightness, or they will say a squeezing or a burning. Those are all very common words to describe chest pain that could be associated to a heart attack.
When we have that, does that mean we need to get to see you right away, or do you want to have a phone call with us first to kind of differentiate?
Yeah, we want to see you right away, especially if it's associated with the nausea, vomiting, and some of the other changes, like level in consciousness or dizziness. We want to see you right away. We want to be sure that it's not your heart, and it could be something else.
So does chest pain always mean that it is a heart issue, like a heart attack or maybe some sort of heart disease issue we're dealing with?
Not always. So the chest itself houses a lot of important structures. We have the heart, but we also have the lungs, we have the diaphragm, we have muscles and ribs, veins and arteries, and all kinds of very important things in there. So any trauma that causes inflammation or infection really could give you the signs and symptoms of chest pain or heart attack. The most important thing is to come in and be seen so that we can make sure it's not your heart.
And you folks in the medical field are always about prevention and being proactive about that. What kinds of things can we do to avoid having chest pain and coming to see you guys?
Yeah, those are called modifiable risk factors, the things that we can control. So quitting smoking is definitely one if you are a smoker. Maintaining a healthy weight with a diet that's low in sodium, trans, and saturated fats is another one. Exercise is also important. Heart disease and heart attacks are highly associated with some other common medical conditions like diabetes, hypertension. So being sure that you manage those other medical conditions with the diet, exercise, and medications will lower your risk.
All good reminders of what to do, and we appreciate your time. Angela Smith here at the Northern Nevada Health System. And for more information, go to our website.